Okay, welcome, good, gentle people, to Making Worlds Cooperative Bookstore and Social Center. Thank you so much for coming out tonight. We got a lot of good work to do together tonight. So, my name is Malav Knuga. I'm a member of the Worker Cooperative here, and in addition to helping run this space, I am an old friend of Jamie's. Who here can say the same? Right on. Yeah, right on. So that almost certainly means that you all have countless stories about Jamie. Very delighted to welcome Jamie to this bookstore. Jamie and I met in New York City many years ago in a similar bookstore, and we've conspired in a lot of different ways since then. And I've seen Jamie's work as a punk, as a scholar, as a union organizer, and as an activist, and maybe one day even as a musician. We'll see. That part of his CV is yet to come, I suppose. But yeah, so I've seen a lot of the ways in which Jamie moves through the world, and have learned a lot from him. So I'm so glad to be able to kind of come a little bit full circle from our early days running around and organizing things in New York City. I remember 2005 being on the picket line at NYU with UAW, so that was also an interesting memory to think about with the current UAW strikes. And yeah. Neither of us were in grad school, I think, at the time, or maybe you were, but yeah, you were. Okay, right. Anyway, it was like, so okay. And to also sort of see Jamie's work as a labor sociologist evolve as well. The topic and the way that Jamie brings care and attention to like everyday issues of work and issues of working class life in this country in the last couple of years is obviously something that's on the forefront of a lot of our minds. And thinking through and unpacking what it looks like to pay attention to and attend to and support and amplify worker militancy in this country is, I presume, on a lot of our agendas as well. So how many of you all are currently, this is going to sound like one of those like immigration tests, currently, previously, or have ever been part of a union? Right on. Okay, that's awesome. That's very impressive. Yeah. So in that case, whatever prepared remarks Jamie has for us, I think maybe we'll forego and we'll just set up a series of watermelons that you can smash with a hammer, and we'll see if there's an anti-capitalist critique somewhere in that. So actually what we're here to do is to launch Essential: How the Pandemic Transformed the Long Fight for Worker Justice. I had the pleasure of visiting Jamie at some point during the pandemic in Vermont, where we were talking about you writing this book and deliberating on possible titles. And as a publisher, I threw in my 2 cents about what a title could be, and I'm glad you didn't name the book Nailed to the X, because that wouldn't have made any sense. Or Worked Over, because actually it turns out you have a book called Worked Over already. So anyway, your publishers treated you well in this regard. So we're here to launch that, and we also have Esteban Kelly here too. Esteban is also an old friend. Definitely been up to no good together for a long time too, and in some ways come full circle to Philadelphia and Making Worlds in some of the similar itineraries that I was mentioning about Jamie. And Esteban, in addition to being the executive director of the U.S. Federation of Worker Cooperatives, is a founding member of PACA, the Philadelphia Area Cooperative Alliance, has supported us here at Making Worlds in developing this as a worker co-op in a social center space, and is part of the advisory council at Making Worlds too, so has contributed a lot to us in that regard as well. And we also have Alex Smith, who's in the back, but has been coming up a little bit later to help us kind of move into part two of things. And Alex is a worker member of PACA as well. So we'll hear a little bit more about what the Philadelphia Area Cooperative Alliance is doing in the city. So with that, I'll turn it over to Jamie. Smash those watermelons. And welcome all. Thank you.
Thanks, Paula. This one also works, right? Cool. All right. He turned it to you, but do you want me to dive us right into the book? Like, you should say hello.
Oh, Thanks to Malav, thanks to this amazing space. As Malav hinted, he and I were part of, Malav really led most of it, but part of Blue Stockings Books Cooperative in New York City, which has some similarities. It's my first time here, but I imagine with what goes on here in Philly. And I feel lucky to share this all with all of you, and especially with Esteban here.
Cool. Yeah, welcome to Philly. And I also get to be the bridge because I think last night you were in Baltimore with another worker co-op doing a talk at Red Emma's. They're also members, I think founding members actually, of the Worker Co-op Federation. So yeah, keeping it all in the family. As is Blue Stockings, as a matter of fact. So here we go. I think, so we're going to keep it pretty conversational. We're not going to read long passages. I'm going to read 2 short passages just to introduce the character, the main character, which is this book, Essential. It's so good. I'm glad that there's a big stack of it. You might have to fight. I hope you have overstock. Great. I was going to say, elbows out, you guys. This is really good, really timely. And at first I was like, right, yeah, like a book about essential workers in the... And then I was like, actually, table of contents, let's go. We've got, chapter 1 is the dispossessed. I was already hooked. NSFW, not safe for workers. I was like, you wrote this for me. I can't even handle this book. It's so good. So the little bits that I have gotten to read are the premise of some of what we'll talk about. So I wanted to do just 2 paragraphs from the intro, and then invite your kind of thoughts, reactions of like where this came from for you when you were writing it. So the first, they're kind of back to back from the intro. And so you start by saying, it was tempting to view the pandemic as a sequel to previous crises. The coronavirus recession reminded us of 1929, the social unrest of 1968, the virus itself of 1981. Instead, the pandemic is more likely to be a prequel to whatever climate change and capitalist globalization bring us next. The risk, then, is not that we repeat the mistakes of the past, but that we transmit our vulnerabilities into the future. This book is an analysis of recent events which can't be changed, and a polemic about what happens next, which is up to us. Which is a really great section, but it's not the last one I'm going to read. So, and then you say in the very last paragraph of the intro, as I finished writing the book, there was widespread hope that vaccines and a new treatment for COVID-19 would soon put the biological pandemic in the rearview mirror. At times, I was even uncertain about whether I should refer to the pandemic in the past or present tense. What seemed clear, though, is that the effects of the social and economic crises will outlast the disease. The turmoil of the pandemic turned capitalism inside out, exposing the rotting core of a system that places profit over people, work over workers, and wealth over health. It also, I should have slowed down and read that as a slam poem, right? It also showed us faint glimpses of a wondrous alternative where we care for each other as if our own lives depend on it. We now know that a safer and saner future is only possible on a broad scale if we recognize the interdependent nature of our work and lives. To do that, we can reorganize our economy so that essential workers aren't at the bottom of a hierarchy, but the foundation of a real democracy. Isn't this book good, you guys? It's so good. Yeah, just your thoughts on that intro, that initial framing.
Yeah. Okay. Thank you. Thanks again, Esteban, and all of you. So I'll just say a little bit about how I started writing this, and then I'll maybe be more specific. So Malav alluded that I wrote another book that came out in the middle of the pandemic, and that book was essentially about labor time. And the question there is, after 100 years of declining hours for average Americans, we began to reverse course. In the 1970s, hours shot back up, and have continued upward ever since. We now work about 13 weeks longer now than we did in 1975. So the book is about why that was. But I wrote it all before the pandemic, and it came out in the middle of the pandemic, and it was like a polemic about why we should all work less. And all of a sudden, like 30 million people had no job when the economy crashed. And I thought that it would be awkward to advise everyone to work less when everybody that wanted a job couldn't have one. But it turns out that the pandemic just made everything that was already bad worse. And so everything that seemed bad in the book was, it almost seemed like prescient in a way that I actually did not expect. And so I began thinking about working hours. So in the immediate aftermath of the pandemic, we began to work more than ever before, which is weird because we save money on commutes, or we save time on commutes. There was all these other ways in which we could have translated or the work from home crowd anyway, could have translated some of that work from homeness into free time. All the data shows that we did not. And so I became interested in that. And then I became interested in the people that did have to work face to face. And so out of what was really curiosity, I just began talking to anyone who would talk to me that had a front-facing job. And eventually I narrowed it down to like education, healthcare, retail, food producing people, anyone who, those kinds of folks. And there's a red thread in the beginning of the book that basically starts out with this woman, Kim, who is a nurse, a traveling nurse around the country. And she's walking in New York, and she's going into work the same time that people are banging pots and pans. Some of you lived in New York, or I assume they did it in Philly, banging the pots and pans for the essential workers. And she went into work, and she basically recounts her day when her patient eventually, passes away from COVID. She gathers her people around to sort of hold hands, bow their heads, take a moment of silence, and then boom, on to the next one. And in the basement of that hospital, on the same night, there was a woman, Mariel, who I interviewed just days later, who a body from the top went to the basement where she worked in the morgue. And they unzipped the bag and found out that the body inside was the uncle of her coworker. They carried that out to the the freezer trucks that were in the thing. And while in the freezer truck, Mariel stumbled upon another body bag that was empty and went to close it and saw that it was her neighbor. So those were like the first 2 interviews I did. And I was like, oh, there's something, I'll write this book, I guess. Because it was just so, there was so visceral and surreal. And my work has mostly comes from interviews. If any of you have ever done work that involves talking to people, like everyone loves talking about their job. Everyone's an expert in the job they do. So it's like you're interviewing intellectuals all the time. And it's pretty, you just get so much data. And so out of that, after about 100 interviews, the book started to sort of take shape. And that's sort of how I started doing it.
Wow. You talk a lot about interdependence and a lot of work around this Ouroboros symbol that comes up a lot. Yeah. And also about bad jobs. Can you say a little bit about what all that means and why that's one of the patterns you return to in the book? Yes.
So the book starts out talking about, or the first chapter is about the recession, essentially, everyone that lost their job. And really it's about 2008, I guess. That's sort of where it starts. So if you think about the American economy today as composed by and large of bad jobs. And it's, in other words, jobs that pay on average below the median level that should pay in that industry. How did that happen? So in 2008, everyone knows there's the Great Recession, blah, blah, blah. How did we recover from that Great Recession? The main way we recovered was to eliminate the middle tier of occupations. And we replaced those decent paying, more or less middle class jobs with low wage, shitty jobs. And it was those people, and that was the birth of the gig economy. That was the birth of Fight for 15. So it also developed a counter movement.
Which, if you're just measuring number of jobs and not quality of the jobs or income of what the jobs produce or sectors they're in, if the only metric every day on the news for a decade is job creation, number of jobs, unemployment, are people working or not, then you're missing some of that gap of that you're mentioning right now.
Yes. Good point. So things look like, so by the time 2000, to your point, by the time 2019 rolls around, there's actually pretty low unemployment. Like for a minute, like wages begin to creep up, largely for Fight for 15 and scarcity in the labor market. And then the crash happens. And, to some extent, we have the recovery from the crash, because people were fired and not furloughed. Like Europe furloughed people, which means you can just hire them back pretty easily, actually. If you just fire everyone, you have like a reallocation problem. You can't just hire people back quickly. It's a total disaster. And we've sort of, the tendency toward replacing some jobs with worse jobs has proceeded apace. The labor shortage and higher wages notwithstanding. So that's in the beginning. And then this thing that Esteban is talking about with interdependence, during the pandemic, like the 2020 had like a left bias. Like reality was like on the side of socialism, because there was very clear that, the old labor slogan, an injury to one is an injury to all. The socialist version is we're all better off if we're all better off. That became very true. In other words, if people around you were sick, you were more likely to get sick. If you're surrounded by well people, the opposite. And it's the same in the labor market. If truck drivers have, if they're more tired from working longer shifts, there's more accidents. If nursing home aides work 3 jobs, they take the virus from home to home to home, and it affected people that they're trying to save. And so there was this real thing where like bad jobs becomes a liability for everyone in the economy. And our American employers are addicted to bad jobs. It's like almost a pathological thing. And breaking them out of that habit is really the point of the labor movement. And so the contrast is also true. If workers have a voice in the job, well, they can point out problems at work without fear of management reprisal. So like if you look on, I'll just see this one thing for a second. If you look on OSHA's website, the occupational safety, whatever, and you see, well, who has worse outcomes at work? What you find is that places with unions have far more accidents, more illnesses, more death.
This is with or without?
With. Uh-huh. And you're like, well, why is that? That's weird. I thought it would be the opposite. And it's because they report accidents and injuries and illnesses, and non-union employers do not. The bias in the data is so strong, you can't even explain it away. Like there's nothing mathematical you can do with it. And so there was a way in which all that trouble was, became a real liability in the labor market early in 2020 and into now. I guess that's where that. So in the book, there's this ancient symbol of the how do you say that? Ouroboros? Ouroboros. I wrote the thing. I don't even know how. Ouroboros.
Book smart, huh?
Like a snake eating its own tail, and so that becomes sort of a metaphor for that problem.
Cool. I think the other element that's front of mind and in fact stamped on as the subtitle of the book is about how the pandemic itself transformed labor movements, labor organizing, and of course, similarly to the conversation about jobs after the 2008 crisis, there's been this almost inescapable conversation about labor power, worker power, a resurgence of that, and actual wins, new union organizing and a resurgence for the first time in our lifetime. We're like basically the same age. Can you connect those ideas about, the pandemic itself, right? Like Arundhati Roy talked about the pandemic being a portal, like in April of 2020, and in some ways it was. And so I'm wondering if you could say a little more about what that transformation was.
Yeah. So it's funny because the publisher sent me the title of the book at some point. And I was like, well, the book is not about this, actually. It's I don't know the answer to that problem. And they're like, well, this is the title of the book. And I was like, oh my God, I better write something about that title. And it turns out that they were right. Like, that was a good idea. And so I started thinking about it more. And so if you look, so in 2020, if you looked at, again, this is like a data thing. If you looked at the BLS, the Bureau of Labor Statistics collects data on strikes. And if you looked at that data, there was 8 large strikes in 2020. Half were led by nurses. And you're like, oh, nothing is happening. There was, 10 times that in 2019 for the strike wave in Red for Ed. And I was like, nothing's going on. That's unfortunate. And then I began interviewing people, and it would be some like meat packer worker from the Midwest. And he was like, oh yeah, and by the way, we struck yesterday. Or like bus drivers in Pittsburgh. Oh, by the way, we shut down the port to make sure that people can deliver their garbage to get higher wages. Or teachers were like, oh, we are not going back to school as people thought because we're going to do X, Y, and Z. And I was like, well, you guys don't even have unions. You don't have any, what are you doing? And they're like, we're doing it. And so in other words, like there's a way in which just pure and simple like qualitative research, talking to people, found all this stuff that was absent from government statistics. And what you get then is like a strange, like bubbly, bottom-up, percolating movement that is filled with not the kind of typical, like people don't walk off the job without a union in America. It basically does not ever happen. And all of a sudden people were doing it left and right. A third of the strikes in 2020 were led by workers without a union. That hasn't happened since the 70s, like the days of industrial wildcats. So that was one thing that was different. Then the pandemic working class was so disproportionately black and brown, disproportionately women, that I think some of the old ways, the sort of racist tropes and gender tropes that typically divide workers was different and was much less possible in 2020. And you had a pandemic working class that was predicated not just on job or occupation, but on proximity to risk. Like, did you risk your life going to work or did you not? And if you did, you were with us, right? You were with this sort of new working class thing. And Black Lives Matter began talking the language of labor. We had to strike for Black lives. And there was much more, leaders of the essential workers movement, Chris Smalls, Amazon, Derek from Amazon, some other people were also leaders in Black Lives Matter. And so the 2020 protests against George Floyd were, very animated by essential workplace organizing, especially in retail and groceries. Industries and education. So it's like there was these weird spillover effects seen inside the workplace organizing and outside, which is like the holy grail. It's like the leftists, every dream we ever had of having that thing, it was like for a small second, it was happening. And so it was important to capture that snapshot, and then maybe at some point we could talk about where it went. At the end.
Sure. I mean, I'm still thinking actually about some of the relationship with OSHA. And occupational safe health. Can you talk about the link between worker power and health workers? I mean, you spend a lot of time with the nurses and healthcare workers in the book and as part of the interviews and the qualitative research. So I'm wondering if you could just talk about that a little more.
Yeah. So the early strikes were about worker safety. All the early protests, organizing, whatever else they're called, was about workplace safety. And for good reason. So unions are long associated statistically with worker safety. In other words, if you're in a union, you're more likely to have employer-paid health insurance. That's better, so you're not underinsured. You are more likely to have shorter hours. Longer hours is a serious health, contributor to poor health. It's associated with alcohol and smoking cessation. It's associated with lower stress. So in other words, there's a long reason to connect unions and public health. There's two ways most people think about this, why this is the case. And the first reason is that if you have a job and it's really bad, you can quit. And so that market mechanism encourages your employer or incentivizes your employer to make things better. So like the exit option from your job encourages workplaces to be better. The other way is that things like OSHA are good and that they protect workers through policy. Neither of those two things worked during the pandemic. OSHA didn't do its job. The market mechanisms never worked anyway. That doesn't happen. And so these two reasons didn't make sense. So in the book, workplace safety is basically the outcome of class struggle. And this is because, people, what?
That's not me.
There's an animal mouthed in the walls or something. I don't know.
Yeah, but that's our landlord.
Are you serious?
It's a rat.
Oh, it's a rat. Oh, okay. Sorry. Should I turn it off? Okay. Wait, are you being serious?
It might be, I don't know. I haven't really figured out why. Okay, tinfoil hat. All right.
Okay.
Talking about. Go on.
It's off now. Okay. So anyway, so I did research with these other people. Adam Dean from George Washington, Athene Venkateramani from here, and Sim Kimmel who's a doctor in Boston. And that research was much more quantitative. So basically, it goes like this. If you have, let's say we studied nursing homes. I used to be a union organizer in nursing homes a long time ago. I've been obsessed with union nursing homes for like 25 years. And during the pandemic, that was the epicenter of the virus. So if you were in a union nursing home in 2020, you were about 12% less likely to die of COVID. And your workforce was about, I think, 9% less likely to be infected by COVID. If you imagine, so the unionized workforce in nursing homes is like 10%. If you can imagine the entire industry as organized, industrial wall-to-wall unions, that's associated with about 8,000 fewer excess deaths, which is insane, right? It's totally insane, which means that union workers save lives. They had faster access to PPE. They had faster access to paid sick leave. They had better access to get the vaccine while getting paid to rest on leave. It was just like very obvious. Teachers, same deal. If the stronger your teachers union, that's more closely associated with the adoption of mask mandates. Mask mandates were pretty good as far as spread, obviously. And teachers often sort of use their bargaining power. People call it bargaining for the common good. I don't know if any of you familiar with this. In other words, use your bargaining power to bargain with your employer for things that affect outside the workplace. So teachers unions would say, we will not accept a contract until our kids' families are priority access to vaccines, or so that our families have time off from work to get vaccinated. Like stuff like that was hugely important. It would have never happened without workers basically stepping up to the plate. So you can think of worker safety as being this sort of nebulous thing, or you can think of it as something essentially that people won. And it's if you don't, that's great. The bad thing is if you don't continually fight for it, you lose it. And so there's people are talked about saying now the extent to which that fight is over, sort of. There is some less of that concern with workplace safety. The vaccines became, and unions opposed vaccines, which was super annoying. Like healthcare workers unions were militantly opposed to vaccine mandates because they're opposed to anything that goes in your body without having a say-so in bargaining. So there was this awkward moment when the largest healthcare workers union in the country opposed the most important public safety outcome we could get. And it was super annoying to everyone, but that's the way it went.
Was this 1199?
SEIU? It was all SEIU. Yeah, it was so annoying. And but they also did do things to encourage people to get vaccinated. Unionized hospitals do have higher vaccine rates than do non, but they also oppose the flu vaccine and everything else. So there's an interesting relationship then between worker power, labor power, and public health.
Yeah. In the quick poll that you just did a few moments ago, we discovered that there are a lot of people who either currently or previously have been workers in a union tonight in this room. And yet, that's, as you pointed out, not that common in the workforce in this country. I will not use superlatives. This country, such as it is. And part of what was happening, and a lot of the illustration that you're doing in the book looks at the intense months of March and April and May, even into June of 2020. And so much of that was experienced over social media. There was a lot of like visceral storytelling and imagery of people showing up, healthcare workers in trash bags, showing up without PPE. I'm wondering, and I don't know how much this came up in your research, but I'm wondering a little bit about the connection. Like, okay, so there's the workers themselves. There's the sort of like behind closed doors conditions of what's happening in their workplaces and what conversations they're having with the businesses that they're working for, right? And the fights that the unions are advancing. But I'm wondering, like, was there something about a public pressure, or like, was there any traction? Was there any connection? Was there any influence, in other words, in the broad-based solidarity? I mean, you mentioned the clapping, the applause in places like Italy and in New York. Did any of that translate, in other words, to the actual bargaining power or the worker power, like the demonstration of solidarity, or even just the sense that there were more eyeballs on all of this and on essential workers?
Yeah, that's a good question. It's like the question of like, what changed?
Yeah, I was gonna get to that part, but yeah,
okay.
That too.
I mean, that's what I guess it makes me think of.
I'm thinking about the audience part and what the role of the audience was in change, but I was gonna ask next about. Yeah.
So most people that I talk to anyway, like felt a sense of pride from being considered essential workers. Like they thought that they were keeping the country alive, and they were. Basically. And so that was a real source of, for the first time, like grocery store clerks were considered like the foundation of a public health revolution, right? It's like they're usually just sackers who make $8 an hour. And to a lot of people, that was incredible. And yet there was also this thing where like their wages didn't go up. Like some people got hazard pay, but hazard pay really was just an incentive to work more. Like hazard pay was usually conditioned on perfect attendance. And perfect attendance was exactly the thing we didn't want at an essential workplace in a way. So that was a problem. And I think there was this sort of a cognitive dissonance between that public support without the sort of material things. We thought it would change. Biden gets elected, and there was a minute when I think people thought this is going to be good. Because this is going to be good. Biden spent his whole career not being Bernie Sanders. That was his entire life. And then he came in as like the next FDR, Lincoln, whatever you want. It was like, yeah. I mean, his first day in office, he fired Peter Robb from the NLRB, which is the largest union buster in the country. And he did all these things. And then, of course, nothing, right? Nothing. I mean, just the other day, as people know, Biden busted or helped bust the railway union strike over paid sick days, like the very thing that we've been arguing about for 3 years. Like the one thing we thought would change. So this is what I was thinking about the no change thing. I only did one interview in person for this whole book. I did it all over the phone. I hate talking on the phone, but that's the way it had to be. So I did one interview. As soon as I could, it seemed like I could travel, I went. And I went to Alaska to interview these fishermen. And it was like, this is going to be awesome. That's what I thought. And so I was helping this fisherman, this woman, that I was on her boat. We went out fishing for salmon. And, we're like fixing the nets in the water in Bristol Bay. And I was like, so what changed for you? That's why I'm here to know. Tell me everything. What changed? And she was like, nothing. Nothing at all. Like it's exactly the way it was before. Except, there's more COVID. But aside from that, 2021 looks just like 2019. And the same people control the waters. The same people control the price you pay for fish. The same people control the per pound, whatever. And she was like, the most shocking thing of all of this is that we did not use the crisis to learn anything. And the publisher of this book really wanted like a really good story to the ending. They wanted like a moral or like a celebratory, isn't something changing? And I was like, the sad fact is like we learned from a labor perspective, we learned no lessons. No lessons was learned. Nothing at all, actually.
Why do you say that?
Well, I mean, like so petitions to file union elections is up 65%. That's insane. Union support or support for union workers at an all-time high. Yeah. Public support for private corporations, all-time low. Like things like the CARES Act made it seem like the state had the possibility to pay for anything. Like a Green New Deal, sure, we have money for that, basically, but yet none of it materializes, right? Despite having like intense public support for these things, to some extent, even including some on the right, like there is some weird right-wing support for the PRO Act, which is the basic thing we need, and none of it materializes. Blocked by Democrats in the Senate.
Wait. So are you? But I want to make sure you're not conflating lessons we learned, support analysis that has been developed among a polity that wasn't maybe previously paying attention with actual victories and gains and legislative or policy changes, right? So the idea that like, I don't know, I kind of feel like we have learned lessons. We do have stronger solidarity. We might not have won stuff. And even there, I think that there's probably a sharper critique of the state and analysis of obstruction. In other words, people who had previously been like, I don't know, Democrats, sure, they're better than Republicans, are now like, yo, fuck these people. Like, why the, like, so they actually have an analysis of like, what's going on with the lobbyists? What's going on the administrative side, even with the Biden administration? And why is it that some of these things haven't advanced, even knowing that demonstrably there's so much popular support?
Yeah. Okay, fine. No, good point. That's true. Thank you for reminding me of that. So I'll say one thing about this that I think has changed, and that is that. But this is a little bit more like I think one thing we did realize that what constitutes like working class solidarity or working classness actually is different. And in other words, like it's easy to picture like the American working class is conservative, white, male, wearing shiny jackets, like union jackets and, whatever. And that is just like such a far cry from what it is today. It's both poorer on one side and richer on the other. Like there are far more master's degrees and advanced degrees in the American working class. Like there's so many master's students organizing at Starbucks right now. It's incredible, and working at Amazon warehouses. And so that constitution of the working class has changed, which does change the way we think about organizing, I suppose. I guess you're right. So we shouldn't confuse that with the, what do you call that? The inability to get demand, to win demand.
Right, to actually, have structural change.
I guess what I'm saying is that there's a chance that if when the next pandemic comes around, unless something serious happens, we will be just as vulnerable this time. Like I really do think that the weakness of the U.S. working class is a factor of public health, and if that's the case, then we are no better off than we were before, and that is a real. Sorry, it's just a real bummer.
Well, I don't want to, and again, I don't want to be contrarian. Right. It seems there's something about the way that I orient to these things where I'm like, yeah, but actually, what actually is? Let's take a closer look. What actually is different? What actually is new? It might feel like one step forward, one step back. So we might be in the same place, but still qualitatively, there is stuff that's different. So, for example, I think in some ways we're worse off for the next pandemic because right when we saw every governor shut everything down, regardless of red state, blue state, whatever, all that bullshit. And then what that looked like 2 months later, 3 months later, that fracturing. The next pandemic, do you think they're going to comply with that level of like total economic shutdown, close all the schools? Like, no, I think we're actually worse off. There's going to be much more reluctance to, we have politicized public health and solidarity around that. So that in that sense, we're worse off. On the other hand, in a lot of ways, we're better off. There's a much sharper analysis. I mean, the thing I was just saying about social media, people developing, I mean, Lord, I don't click on Atlantic articles anymore because of how grim. But having an analysis about these things, right? That year where people were like, I'm a baby epidemiologist, right? So in some ways, like we're actually way more advanced than we were in 2019 and going into the last one. And the fact that there's a good slice, I wouldn't say it's broad enough, but a good slice of people who have an awareness that there are more to come, and who are connecting this stuff intersectionally and connecting public health to racial oppression, racial and economic justice, to poverty, to just the geography of vulnerability in that way, and essential workers.
You should write a book on that, on that more optimistic thing. I think that would be a good book.
Glass half empty, glass half full over here. Yeah. Before we open up, I'm wondering, maybe the last question is more about that transformation. If you want to share a little more about like what is transformed, and so for some of the workers you talked to, it felt like nothing was, but you clearly went through a process in speaking with these people, engaging, connecting it to your decades of research around this work. Like, what do you think is different?
Yeah. So the end of all the books that people like me write is like, what is to be done? That's basically the way you end every book. The chapter is always thinner because no one really knows, and it's always like And but in this one, I try to outline a few things, and so I'll just say a little bit about what those were and why. I think the most important lesson to be learned from the pandemic, it sounds like, and this stuff always sounds really boring to me because it sounds obvious, but we're not getting it, so might as well say it again. And that is that, like, basically we need Medicare for all. Medicare for all is good for all the reasons we can imagine, but it's from a labor perspective, it's really good. So basically, if you have a contract at your work or whatever, when it comes time to negotiate your thing, like it's more typical to bargain over health care than it is for wages. So the need to bargain over private employer-paid insurance is a safeguard on raising wages. It also pulls people into longer hour jobs who would otherwise work shorter hour jobs, because to qualify for health care, you have to work a certain amount of hours. And in public opinion surveys, everyone's like, I'd rather work 1 day a week rather than 4, but I'd also rather have health care than not. And that's why they end up doing that. So healthcare for all takes healthcare off the bargaining table and puts this power back in the hands of labor.
Around wages, conditions, workplace conditions, things like that.
Everything. Yeah. The other thing would be some sort of renewed movement for shorter hours. This is really a holdover from the last book, but it's like, there was this whole book's about essential work, and at some point I was like, well, which takes up, let's say, about a third of the economy, and then I was like, well, what's not essential work? Like, what's
bullshit
that?
Jobs?
Huh?
Bullshit jobs?
I don't know. I mean, I guess not essential work is some stuff we're doing from home, and that's important stuff, obviously. But like, how much stuff is being done that is not in the name of national health, security, whatever? And it's like, so what counts? So like during the New Deal, for example, like art counted. Like, how do we know this? Because they funded the arts. And so it was like considered essential to the American experiment to fund artists. And there is no like pandemic sculpture park grants out there for like art workers or creative workers, right? There's nothing like that. We don't have like a great national conversation on what work really has to get done and what doesn't. During the pandemic, like I interviewed 2 families who lost their loved ones who were greeters at Walmart. Like they have to say, they say like, welcome to Walmart when you come in the door. That was an essential job in 2020. We don't have to do that job ever again, right? And so how do we divorce a dignified life from the need to work? That question was sort of asked in an existential way, and there are obviously a slew of policies, paid sick leave, paid FMLA leave, vacation time, whatever, that can attend to that. What is the last one?
There's something else that's funny about the kind of logics of capital that, at least in this country and kind of in the UK as well, the way that they think about the political economy and approach it, where because we fought and won for there to be unemployment benefits for independent workers and freelancers, people like one of my best friends who's a tattoo artist he was on unemployment. And so suddenly the state, and also the fact that we don't have federal policies, it's like state by state, whatever DC is, Puerto Rico, et cetera. And so the governor in Oregon, where my bestie works, was like, sorry, you're an essential worker now. And he's like, I'm what? I give people tattoos. It's an elective surgery. Like, what are you talking about? And they're like, yeah, well, now you're off the unemployment rolls. So what does that look like to not even have a universal, even if we have a universal understanding of what essential work is, to not have, from a policy standpoint, a universal definition of essential work? I think that's dangerous. And in some ways that draws clearer battle lines for what kind of fights do we need to be waging on behalf of workers.
Yeah, that's a good point. I mean, so like to your point, I was fishing this summer in Montana, and I was talking to my guide, and he was like, I was like, what did you do during the pandemic? And he was like, worked. And I was like, why? And he was like, oh, well, all Montana fishing guides were deemed essential to the health of the state. And I was like, why? And he's like, I don't know. I got COVID, and he just no idea, right? And it was so capricious who was in and sort of who was out. Yeah. And so I guess, the other thing that I think is important, and this thing we should touch on, is and toward the end of the book, I talk about is the care work question. And that, if we're going to
around like social reproduction, because I was going to ask about that. I know.
What were you going to ask?
Just to talk about that, like the role of social reproduction, how that figures in, and how you explored that.
Okay, thank you.
Yeah, we're just going so out of order, but it's fine.
It doesn't matter. Yeah. So there's a part in the book that basically tries to step back from the sort of front lines of the pandemic, so to speak, and talk about, like, reframe the idea of a pandemic as a crisis of social reproduction. In other words, the fancy way of saying, how do we regenerate the workforce under conditions of capitalism? And the way this typically is thought about is that there is a segment of the working population, either unpaid or paid, typically low wage, probably more likely to be done by women, that basically does the work so that the rest of work can be done. Like, we're talking about caregiving for our kids, elderly folks, disabled people, that kind of stuff. And it's a necessary condition for the functioning of any capitalist society. And yet the profit motives, intrinsic to capitalism, undermine the ability of those workers to do that job properly. So it undermines the quality of care that we all need to carry out our daily lives. And that cycle of continual undermining, basically has an endpoint. In other words, we have a constant trajectory toward crisis of care work. And that obviously can't go on forever. It's pretty bad right now. What is people always ask me about the labor shortage. I don't know if you were going to talk about this, but they're always like, why is there a labor shortage? And it's like, well, if you think about reframing that question, we have a surplus of bad jobs. That's basically what we have. We don't really have a labor shortage.
Which we usually patch over through immigration policy.
Right, there's all kinds of ways which you can hire people which don't work anymore. Yeah. And then the other thing we have is a care crisis. We recovered about 80% of our child care capacity. We recovered about 70% of our elder care capacity. Nursing homes are more empty than they used to be because people don't want to put people in those places. Wow. And so you can't work. Every week the census just asks you, why didn't you work this week? You can just look up what they say. And what they say is that we're taking care of someone, basically. Almost no one says, we don't want to work anymore. Are you creeping over here to do something?
It's time. I know. I said he's closing on this. I know. I have a
So it's basically how do we prioritize propping up in that sector specifically? We have about 7 million registered nurses in America, which is 1/5 of the global registered nurse population, and yet they don't work. They're leaving the bedside like bananas, right? In other words,
they're also burnt the fuck out.
Well, that's why they're leaving. Yeah, that's why they're leaving. In other words, we have a system that does not fulfill the basic functions of prioritizing jobs that take care of people. Like, just imagine if we had a socialist economy and there was a nursing shortage. Everyone on the right would be like, oh, well, of course there's a nursing shortage because we have a socialist economy. Well, now we have a capitalist economy and there's a nursing shortage, right? It's like we should be blaming that system on that problem, and we're not. And I think like realizing that problem as an outcome of the pandemic would be a very important outcome.
Well, that's a great note to close on, Jamie. Thank you so much.
Yeah.
A round of applause for Jamie and his book, Essential: How the Pandemic Transformed the Long Fight for Worker Justice. I'm inviting Alex up, right?
Yes.
Oh,
Yeah.
you have your own mic.
Well, this is going to be
Get it,
Alex's.
girl.
This
Yeah.
is going to be Alex's mic. So, let me welcome Alex Stewart, member coordinator at the Philadelphia Area Cooperative Alliance, to tell us a little bit about what PACA is doing. Clap, 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 and then also help field some questions from you all.
Hello.
Why don't are we swapping? Why don't we swap? I think you should be between the phones.
Yeah. I don't want to take your seat. Now I feel like a capitalist. Yeah, I'm Alex Stewart. I'm with the Philadelphia Area Cooperative Alliance. Been there with them since May. And yeah, sort of to tag on the conversation here, what we're looking to do, me and my colleague Josh Reeves, who's also a part of PACA, is we understand that capitalism is failing in every industry. And we're trying to supplement that with the replacement, because we need replacements for these industries, these schools, these meatpacking places, nursing homes, what else is in housing, how we're doing housing. A lot of people were struggling getting evicted during the pandemic because their landlord didn't want to talk to them, but also wanted more money. And like, so these processes we can handle on a local level, we can handle in our community, and PACA is looking to do that. Marry the economic transformation that needs to happen with a social understanding of what we need as a people, and bringing that to the most local level possible. And so that's where PACA stands to move. A lot of our work then means that we have to work in marginalized communities that have been overlooked by the current capitalism economic system. And we're looking to do that, get more people engaged, get more people involved in the things that run their neighborhood, the things that run their day. Like we're saying, this care economy, this thing that's overlooked, that's an industry. People are making money there. People are making money caring for our elders that we can do, that we can be paid for, and that be a part of our community. So that's where PACA is looking to build. It's been doing it for 10 years, thanks to the work Esteban put in starting that. And I'm happy to stand on those shoulders and continue that work.
So we're going to open up for questions.
Yeah.
Mala's running a mic.
And we said that my nephew Oliver would have the first question.
Are they ready for it?
It's like how to use the F-bomb in a sentence, I suppose, right?
I think I demonstrated that.
Yes, you did.
No, we don't have to put him on the spot. I was just joking.
Oh, okay, that was a joke. Okay.
I thought you were serious. That's rude.
Rude.
Bad uncle.
Bad uncle.
Any of the Middlebury class of 2018 would like to have a question?
Sure. My name's Molly. Thank you so much. I did go to Middlebury College. I am curious. I worked in a hospital during the pandemic. I'm a nurse, and there are lots of different scales of power even within the like spaces of essential work, so like physicians versus nurses versus techs versus whatever. And I'm curious if you talk to people at those different scales about how they're conceiving of like labor or organizing, at all those different levels.
Yeah. Hi, Molly.
Hi.
Good to see you again. This is a great question. And so there's two things, I think. Like, there was obviously this outpouring of support for nurses, right? Are you an RN? I can't remember. Yeah, right off the bat. Do you work here in Philly? Is that where you experienced? Or? In New Haven. Okay. And so you probably experienced some of that, like sort of public, right? And my understanding is that the same public adulation was not directed at the janitors or the dietary staff, and sometimes even the doctors. Nurses did seem sometimes to steal the show. There was a moment in 2020, I think, where like working class consciousness was less siloed in occupation or work site, and was more about like your proximity to risk. So in that sense, different levels of a hospital chain ended up having some affinity more with each other than they did with, say, like a laid-off janitor or something, or someone who wasn't in that particular sphere. And also with the delivery drivers who come to bring the hospital stuff, and also with the retail workers who sell them groceries after work or whatever. So there was a way in which that working class consciousness was not typically, like, there was more of an experiential nature to it, I guess. This is what I gathered from people. I mean, you worked through it. And, but I think, in other words, it seemed anomalous to me because those same divisions seemed less certain all the time. The only way that that was not true is that, we don't know how many people who were essential died of the disease. We don't know because we don't collect data on people's occupation, actually, which is insane. But we do know nurses. Nurses, died at a very high rate early on, but they were soon surpassed by dietary workers and custodians in hospitals, who were much less likely to get access to the same PPE, much less access to get paid time off, etc. So there was that occupational divide a little bit, I think. Thank you. What else? This is what it's like teaching at Middlebury, by the way. No one really talks right off the bat.
We didn't have that problem when I had a mic.
That's true. Yeah, that's true.
Yeah, just because nobody else is talking. I was just thinking recently about. Thanks for one thing. I was just like, it's always great to hear what you're working on, and I didn't realize this was happening. So thanks for doing this. I haven't watched any of the recent TikToks about that have turned on nurses. Have you seen this thing where nurses are talking about the icky things that they've encountered, especially some people know what I'm talking about, right? They're getting fired. Everyone who's posting, or I think a lot of them who have posted, are getting fired because there's been this outcry. The reason I'm bringing this up is, like, when does certain kind of essential work function as significant because people think of them as service, right? So because these nurses didn't do what effectively is expected of them for the people going to the hospital, or I mean, I'm not sure who's Oh, okay.
It was much less about like kind of affective expectations and more so about lack of womanhood and mortality rates with labor and delivery specifically, and they were shit on them basically, like shitting.
Oh.
So that was
Shitting on, like,
patients publicly.
yeah, right. Yeah, okay. Well, I don't know. What do you want to say?
Well, Jack,
Complicated.
yeah. I mean, if there's one thing there's one thing I don't know anything about. It's TikTok. Let me just say that off the bat. But to save you, at the end of your question, I think that I don't know what the firing thing you're talking about. Maybe there's a specific thing that I'm not aware of. But there was one interesting phenomenon that happened is that in healthcare in particular, is that traveling people were paid extraordinary amounts, right? Like 5-6 times the rate of I don't know what you call a nurse at a hospital. So it sort of, and because people were leaving the bedside during the pandemic, we had to hire more surge capacity in healthcare professionals. For a while, we could sort of stomach that extra cost. And then, as of 8 or 9 months ago, we began to not being able to stomach that. So we began to laying off people left and right to sort of save money. And then hospitals are left understaffed. And some of those people can't just get their old job back. So there's like a real, like economists call it a reallocation problem in the sort of healthcare realm, where nurses are in high demand, yet are being fired, and yet can't be rehired easily. And that, is like a cluster of enormous proportions. And so maybe, there's some of that sort of churn going on in healthcare work. The best thing that, as far as outcomes, to some extent, that happens from that, nurses across the country typically fight for one like very, very important thing. The longest strike in the pandemic, nurses in Worcester, like 310 days or something. I mean, it's insane. Nurses strike usually last 3 days because they usually get what they want, because they have a lot of leverage, and people are like, we can't let people die, whatever. Not during the pandemic. Like, they took them for a year, right? And what they wanted was a patient care ratio. In other words, a legal thing that says if you're in a hospital, if there's 10 people in a hospital, you have 2 nurses, or whatever it would be, I don't know. And there's only one of those in the country, in California. My old, the union I worked for won it. And nowhere else do you get a legally mandated patient care staffing ratio, because hospitals do not want to give it to you. You know, and I think there's probably some questioning of that labor force going on now, but that's one dynamic that's been happening.
Hey, I'm Dan. Hey, Jamie. I met Jamie like when he was still a punk rocker, I think, and also was one of the first people I met that worked for a union. So that was interesting. Anyway, so I was just wondering if you could say more about I don't know. Did I just lose this? Any changes you've seen in, like, more about the education workers. You know, I feel like there's, I mean, mostly because I'm close to a lot of them. I just really saw this roller coaster of, you know, heroism, and then they're unionized for kind of holding out the longest on mask mandates, and there was so much kind of resentment. We're just, you know, I think the amount of teacher turnover in the Philly school district was like 200% higher than this year, and it, you know, it seems like unsustainable. So I don't know. I'm not sure I have a super specific question, but just, I don't know, the framing of your book, how the pandemic transformed the fight for worker justice. Like, how do you see it having transformed, you know, the fight for better conditions for teachers or for better education in public schools?
Yeah. So, thanks. You know, teachers are a third organized. They're more more densely unionized than any workforce in the country. You know, this thing that I mentioned briefly, I think is a really, really significant development, and has been spread. It's probably the strongest teachers union in the country is in Chicago, probably, right? The CTU, which is led by a dissident caucus, core caucus, which has been either striking or threatened to strike for the last 15 years all the time. And that militant spirit really, you know, went viral in the 2018, 2019 teacher strike wave. And so when I talk to teachers, they would be like, you know, I would say, how did you learn to do this? Or where did this idea come from? And they all said the Red for Ed strike wave. Like, they all learned about collective organizing on those picket lines during that militancy. In other words, there was a real educational payoff for that, which no one thought was happening. And that really took place, that was sort of got a second life during the pandemic. And the most important thing was this bargaining for the common good. Like, teachers are public sector workers by and large, and how do you take your position as a public sector person and transform it into power for your students, for their families, and their communities? And teachers' unions are experimenting with that in ways like they haven't been, especially around public health stuff. The mask mandates, you know, Chicago did a lot of, like, the CTU in Chicago and the LA Teachers Union fought for, like, really delayed back to school programs. They fought for better ventilation and all these things that just don't take place in schools without unions. And so I think that kind of experimentation in a public sector job like that is really good, and is sort of now paying off in, like, what do you call it? Like, cross-pollinating into other industries, because there's a lot of teachers unions who know a lot of people in other places, and sectors are trying to adopt that model. So that's one thing I guess I would say.
That one works. For PACA to step in, and its new iteration is okay. Now I have two mics. It's like you said, capitalism is failing, and a lot of these answers we're looking for are coming from, like, these external sources, these corporate Goliaths that manage a bunch of nursing homes or have schools or our school district that's really organized. And we have to get these things to a local level. So like some of these decisions are being made. Some of the decisions that are being made are not for profit, or not because it's cheaper to send a nurse and looks better to send a nurse from another state over, versus like we need enough hospital beds so nurses aren't quitting, and we're giving our nurses enough hours of work so they're not going insane themselves and then are also in a hospital bed that we don't have for them. So that snake eating itself that you talked about earlier. Yeah, we have the solution. I don't think we're in a space as the American public where we're looking for an external resource to come save us a lot of the time, and it's us that is going to save us. We are the working people. We make these big GDP numbers that they see that gives the United States its big weight. We make that as the working class people, and once we start moving that, once we start throwing that around, similar to what people were trying to do with this rail worker strike. They were going to strike and shut down this economy, and that would have had great effect, but our government got in the way of that. And we have to see that our government is starting to not take our side anymore, and it is us. It is the people who pay that tax money to get this government to operate that has the weight. And if we stop moving, then this country stop moving, and we can start moving in our own direction. And it will be in a more localized way. We will have to care for our people in our community. And feed our own community. Like you said, we can't be shipping food, the same idea, shipping food all across the world to feed a small few and waste a bunch when we can be growing food in our own locality and supporting our own economies locally. So this is a great place. I know you guys were talking about, if things got better or not have gotten better. I agree, like more people understand, what is broken, but we haven't really identified where we're going yet. And I do believe this is where Pocket can come in with localized solutions.
Is this thing on? Yes, you got it. Okay, good. The railway thing you bring up is a really important thing to return to, actually. Like the Biden administration did some things that were good to support unions, actually, which never happens, and they did, until unions had power. Right? The railway workers have power because they can shut down the country. And when you can shut down the country, you have a lot of power. You have a lot of leverage. And it was up until, to some extent, up until that point when we were like, oh, that's fine. That's good. Let's support these people while they're weak and ineffectual and whatever. And that test was really significant. And with I interviewed a couple of railway workers in the last couple of weeks just because I can't stop doing this. I wrote a book. It's not going to the book, but it's like just from my own interest. And what people said was they were like, unions are essential for what we're doing, but they're nowhere near enough. Like they are the old necessary but insufficient condition for a real revolutionary transformation. And so of course workers need protections like all the things that we think that they should get. Yet that's it. That's all you want. That's the horizon of your hopes and whatever. And so there's, I think to this point we were talking about, the what's changed, whatever. It's like I think there also is a greater realization about the kind of how should I say horizon that the American labor movement is considering. Like Chris Smalls and the Amazon people, the Starbucks workers, the UC strikes that are going on now, like those are, granted they have the UAW, but it's not the typical UAW. And they're doing things that they just weren't doing 2 years ago. During the pandemic, the IBEW and the CWA won 36 weeks of family sick leave, childcare, and care time off. Like that's a small sabbatical in America. Like insane, and those kinds of gains that sort of don't make headlines all the time, but are nonetheless really significant to people's everyday lives. I think we learned to experiment with those kinds of gains, and they're really they're critical. It's basically like care infrastructure.
I do. I always do, but I know when to. Okay. Hello. I want you to go. You're going right up to the edge of it, and I want to just push you right into it, which is to actually paint a clearer picture of what is possible and what the limits are. Well, no, you already illustrated the limits. Like, what does it look like for workers to own the means of production? What does it look like? Like, why is, not just cooperatives generally, but why do you see, Alex, worker co-ops and worker ownership as again, it's not going to be everything, but what does it look like for us to start to see worker ownership as an essential, yet another essential tool, even if there are insufficiencies around it? And how is that part of us having a bit of a paradigm shift? So no longer saying we want to extract concessions from capital, but what does it look like for us to actually own the capital, for us to control capital rather than capital renting out labor? You know, for the workers to be like, well, how much debt do we need? Okay, yeah, we'd like this, this, and this. Thank you very much. We're good. So yeah, a little bit of your thoughts, each of you, about that. And are we closer? Are we better? Is there a better understanding? How are we positioned?
You are the president of the U.S. Federation of Worker Co-ops.
Executive director, but go on.
This seems like the question, the constant thing of you're asking a question that you yourself are best positioned to answer in a way, which is a good move.
That sounds a lot like your experience doing field work and interviewing workers when your whole beat is essential workers. I think it's totally legitimate for me to talk to people such as yourselves about, like, what is your perspective about this? Because I'm not asking for the answer, I'm asking for your answer, and that matters.
Yeah, I come from a long family background of union folk, and I always pose the question to them, you know, if sort of before this rail worker stuff happened, like, you know, if the government gets in the way, or if the government is so intertwined with union leadership, you know, how is it a feasible alternative? And I think, like you said, it's just experimenting, I think, is what we're doing. In terms of co-ops, I think it really is just experimenting with not being compliant in the system that we were given. We're all children of capitalism, and so we're giving those means. That's what feels comfortable. So it's asking people to feel uncomfortable. It's asking people to do something that, you know, may not have the same guaranteed returns as a paycheck, but will have deeper rewards for your children and your children's children, you know? And so I think we have to be comfortable. We have to get comfortable with being uncomfortable. Either we choose to do it or it will be done for us, as we see. I think this pandemic with the CARES Act, trillions of dollars were given to the richest people, richest corporations, not given to the everyday workers that worked every day that I decided to dress like. I think co-ops are a tool, one of the tools, just like community organizing, just like labor unions. And we have to get used to wielding those powers that those different tools will bring us as people. And I think we have to keep experimenting with that.
Yeah, it's a really good question. It's something that I sort of stopped short of going there a little bit in the book, but you know, when I'm thinking about it and hearing, you know, what you're saying, I think that, you know, if we look out where there's another important thing that's changed that we didn't really talk about, and that is that we've basically cut in half child poverty. Like the CARES Act, the American Rescue Plan slashed it, and that hasn't changed that much in the last 8 months, even though a lot of people predict it will, you know, return. But that's really important. There is still pandemic era, how would you call it, unemployment checks or whatever, welfare checks sloshing around the bank accounts of some poor and working class people. Those things are really good, and yet we sort of champion those kinds of things, yet they don't fundamentally change the balance of power or the balance of class forces in the country. It's not like just about money. We typically think of like, oh, we need to fund this and fund that, fund public health care and fund this. But, you know, doing something that would, like the gains that we won in the 30s, the New Deal, we typically imagine them as like the sort of heyday of America, of the liberal project. But they were really compromises with the left flank of labor, the Socialist Party, the Communist Party, and the militancy within the labor movement. And so now, whenever I say, oh, we should pass the PRO Act, we have to pass the PRO Act, which is the main thing that will reform labor law in America. It's the only reform we've had in 90 years. It passed a vote in the House and it waits a vote in the Senate. And people think that that means we will get the PRO Act, and then it will be easier to organize workers. And what history says is that you won't get the PRO Act unless you organize workers. Like, you have to create a crisis big enough that the state will give you something that you can actually work with. And so when I think about like the co-op model or, unionizing or something like that. Like I think about them as ingredients of a movement to really generate a huge crisis of legitimacy for the state, and a crisis big enough to extract concessions. You would think the pandemic would be that. And like a lot of people thought it was and tried to make it be one, but apparently it was not. And so, there are people thinking about how to do that, sort of how to engineer it. And in certain industries, care economies to some extent is the perfect example. Like you can sort of think about that. But that, I think, to your question about what does it really take or what it'll look like, I think that kind of momentum toward, like a multi-pronged momentum toward creating that crisis is really valuable. Rebecca?
This last question. No. I didn't mean to.
Let Rebecca talk because she's came all the way from New Jersey.
Yeah, exactly.
What about New Jersey now? Can you put any language to the sort of the dormant political power of the sort of watcher class of the pandemic? So we've sort of alluded a few times to this sort of like the budding consciousness, and as that was happening, and people were sort of at home and like, oh Jesus, white supremacy is like for real, But it's like that was also predicated on this other sense of like, it's such a relief that like the capitalist machinery is like slowing down and like I can finally understand the world. And it's like, so on the one hand we have this like incredible work activity, the essential works, and then you have these other people who are sort of like narrating the failures of capitalism, to sort of use your language, like in terms of sort of a stopping, and that sort of seems like such a big deal that it's kind of enough in a sense. Like, and so my question is, it feels like there's something about sort of like what is the hidden capital in that sort of consciousness, and sort of how does that get alchemized? You know what I mean? Yeah. Like, because then it becomes a sort of, it retracts to being like a personal drama again about sort of returning to work and dealing again with the sort of complexities of like, I don't mean that in a cynical way, but it's sort of like, it feels like for the sort of, I know that to say the watcher class is not like good enough, but I'm just saying, it just feels like there's something, the power to the problem is the internalness of that sort of.
By the watcher class, you mean like the public?
Yeah, and where this sort of, there was some shifting of consciousness. Like, yeah. So that seems real and important, kind of. Yeah. But I'm just wondering sort of like how to imagine sort of what's hiding out there in terms of like political capital, and sort of how to like alchemize that. Yeah, these are really big questions. But thank you. This is the end chapter of the book is kind of like, how can worker unrest translate into greater social change, I guess. And of course, there's no great answer in that chapter, unfortunately. But I think that one way that people think about this is like how metaphor of like a social picket line. In other words, like, and this kind of stuff happens around some of the picket lines that set up in some of the protests during the pandemic. If the New School picket lines, the UC's picket lines, which are both the longest and largest strikes in education history in California and recently in New York, they were joined, like those weren't just adjuncts and grad students on the picket line. They were joined by nurses, they were joined by Starbucks workers, they were joined by Amazon folks. Like it was a social event, It wasn't just like, oh, those people are on strike. It was like, we're on strike. And I think that kind of social, how would you call it, like refusal or resistance to that kind of capitalist countenance, like there was some degree of that was born during the pandemic. There was a couple of early videos of protests in April, and they were they were all different kinds of workers, like at the same picket line, at the same protest, and they were just passing the mic down the row, and it's like usually you don't see that. It's like, this is our job, we're on strike or whatever, right? And so I think there was that might be one way, like how do you galvanize people who support you but have no skin in the game? And it's like, well, they do have skin in the game, exactly. Actually, like we are all better off if we're all better off. And I think that you can't really imagine that. Like people's lives were transformed in the midst of a struggle, not by reading
whatever it is I taught the front row on sociology 201, you know, it doesn't work that way. And so like how do you bring people through a struggle, even if it's not their struggle? And there's some strikes and stuff going on now that I think is attracting people who are like, I want to be part of this, or I want to be part of that. And Occupy, there was a moment with Occupy for that, and it kind of fizzled out or whatever. But I think that might be one way for that watcher class to like intervene in a real way.
Yeah.
Well, I very much want to thank you all for being here, and for Jamie and for Esteban and Alex for joining us as well. I do feel bad because I think Oliver did have a question, which was, I think it's, will you sign our books? Yeah? So, yeah, please do pick up, if you can't take Jamie home with you tonight, at least pick up the book and take that home with you. And thank you all for coming. And please ask Jamie all your questions as well.
Thank you.